Did you know that before we implemented universal Hep B vaccinations in childhood and infancy, 20,000 kids and infants a year were getting infected with Hep B? And it's not because kids and infants pre-1991 were engaging in intravenous drug use or risky sex. It's because Hep B is extremely infectious, like 100 times more than HIV. An infectious dose can exist in microscopic amounts of blood. It can survive on surfaces for up to 7 days. And most people who are infected with chronic Hep B don't even know that they have it. So kids can get infected by shared household items like washcloths, earrings, toothbrushes, or razors if they live in a household with someone with undiagnosed Hep B. The birth dose of hepatitis B vaccine reduces vertical transmission by 75 to 95%. It's no secret in this country that healthcare sucks. Some people get very little to no prenatal care. Some people will be screened and then be infected after their screening. Some people will never be screened, and some people will be screened and their results will be written down incorrectly or there's an error in the test. One review found over 500 instances of medical reporting errors when it came to hepatitis B prevention in a 3-year period. So that dose is a catch-all, and for some people, delivery will be the only time that that child interacts with the healthcare system. So giving them a dose then will give them a level of protection that will continue through childhood. Chronic Hep B has no treatment. You can be infected for decades without even knowing it until it develops into more serious complications like liver disease, liver cancer, or the need for transplants. 30 to 40% of the 1.25 million people in this country who are estimated to have Hep B were infected in childhood. We used to target the hepatitis B vaccine just to high-risk groups, but we found that that wasn't having an impact on population levels. Since we changed the recommendations in 1991 to recommend universal Hep B vaccines starting at birth, pediatric rates of Hep B have dropped 99%. Infants under 1 who are infected have a 90% chance of developing chronic hepatitis B. If people want to have a conversation about their personal risks of exposing their child to Hep B, that's one thing, but public health recommendations are made for the population. So please don't let anybody tell you that there's no reason to give an infant a Hep B vaccine, because that's simply not true.